So without further ado, I'd like to introduce our speaker, Fina Robertson. All right, go for it.
Well, thank you so much. I hope that you guys are super excited and ready for a fun chat. You guys should be able to see my two sweet, crazy babies. Is that all right? Thank you all so much. So I'm really excited to be able to come. Thank you so much for CalABA and the BAE-SIG for inviting me and for us being able to chat and talk about some of these super fun things. As you guys can tell, I'm still at school. Right. So I am a school-based behavior analyst. We'll be talking a little bit about why this research means so much to me and how this is going to be working. But for right now, I'm really excited to talk about some of the recent work and research regarding ethical competence for the school-based behavior analyst. I'm sure you guys have seen it too, but as the number of BCBAs increases, the amount of us working in schools increases. And I worked with a really wonderful team of people on this project, and we asked ourselves a really big question, and that's, are we really prepared to work in these complex, ethical, and collaborative-based settings that are unique to our educational system? So I'm going to take some time to walk through this research, why it's so important, what we found, and what I think we should move forward next in. So before kind of diving into it, that's me. Oh, I'm skipping ahead already. I really wanted to share a little bit about my background and why this project really, truly means so much to me. So I have been working in schools since 2012. I still work in schools. I'm here right now, right? So I worked even earlier than that regarding residential schools. And I've been here since I became board certified in 2016. And my work has really spanned from working in grades pre-K to grade 12, working in different systems like MTSS, PBIS, and different social emotional learning groups, as well as supporting the quality of our self-contained classrooms and inclusion teams. So kind of my role with you all today is a little bit twofold. Researcher, for sure. I recently completed my doctorate, and I've been able to research and focus on various aspects of public school work, which has been fun. But I'm also an active practitioner, right? I live these challenges and scenarios that we're going to talk about. I live through navigating these ethical dilemmas like you all do, through supporting teachers, collaborating across teams, and supporting administrators, right? So that's why this project and this work is really so much to me. It's not just an academic exercise. It's really work that's, directly connected to what I do every single day regarding our school systems. And so I just kind of wanted to draw attention to why that means so much to me and why I'm here. And with that, so has my team. Just like working in schools, this project was truly collaborative. I've had the privilege of working alongside this team with a shared goal to examine feelings about being ethically prepared to work in schools. I am forever grateful for my team's dedication and support, both in this project and in our work every day. And within the presentation, some of their work is in this as well, showing with you today. So I'll tell you a little story about how this came to be about. Spoiler alert, there isn't much out there regarding ethics in schools. Oh, is anyone seeing a slideshow? Oh, is there an issue with my presentation? Can you guys not see it? It's not working? It's not published?
It's working.
Oh, it is working?
It's working. Looks good.
Oh, okay. I'm sorry. I'm just catching up on the chat. All right. Appreciate it. So before I kind of get into my story about how this kind of came about, I wanted to talk about a second, why my team and I really felt like this research mattered. So the number of BCBAs working in schools has dramatically increased over the past decade. And while this is really exciting for our field, it raises some new challenges in supporting preparedness to be ethical behavior analysts. As you guys know, schools are incredibly complex ecosystems. Behavior analysts need to navigate special education law, individualized education plans, navigate interdisciplinary collaboration, sometimes conflicting contingencies between administrators, teachers, families, and the student themselves as well. But most of our graduate training programs still focus heavily on clinical or home-based settings. That means many BCBAs walk into schools without direct preparation for this environment unless they receive practicum hours or supervision hours in this setting. So this is where I kind of like to pause and take a second. I'm going to pull up the chat because I want to ask you guys, is this something that you feel as well? When you guys first walked into working in public schools, did you feel prepared? Did you feel ready to work in this setting? No. Kinda. All right, I'll take it. Nice. Somewhere. Oh, some because you were previous special ed teachers. Sure. We did get some yeses too. Hi, Becky. Good to see you. Yes. Oh, credentials, somewhat. So I'm getting some mixed results, which is really good because we were also able to see that in some of the survey results too. But now, 20 years, right? It's a lot. The schools have a note. I know. I hear you, Tara. Tara, I apologize. I want to make sure I pronounce it correctly. But we see that as well. Services in schools. There's other contingencies that have been at play that can help with that level of preparedness. I have more questions, so I'll pause. But that's very similarly to what we saw in some of the training results, right? Or some of our survey results, is that there wasn't a lot of preparation that was noticed. So I'll go into that shortly as well. So beyond the kind of growth itself, we need to consider the professional context we as behavior analysts are stepping into, right? So recent research has shown that many school-based behavior analysts work in isolation. There's limited structure, peers, or supervisory supports. Now, I'm not as familiar with California education. I apologize. I'm a Massachusetts girl. What is that like for you here? Do you have a collaborative team? Do you have other BCBAs that you get to work with in your school buildings, in your district? In my school district, we have about 2,500 students across the district, and we have 4 BCBAs, one in each building. So how is that similarly to you guys? Are you working in multiple? It depends on the district. Yes, definitely same up here, Tiffany. Okay. Oh, 8 BCBAs. I wonder if that's a big district. 8 in the county. So some levels of collaboration. Has anyone felt like they were on their own island? 52 schools. 3 BCBAs for just solo. See, solo. 14 schools. That's a lot of schools. Being the BCBA for the entire county. Only BCBA for 3-ish years. That's a lot. And that can be really difficult because not only do we maybe not necessarily feel as prepared to work in this setting, but we don't have that level of collaboration and support from another behavior analyst to bounce ideas off of, but to review hot cases with, right? That limited level of structured peers can impact the quality of the work that we're providing, and that can be difficult. There's a lot of professional standards that are coming out, which is really cool as well to see. They're state by state, but professional standards that are now more and more upcoming show that competence in schools working in this specific setting requires more than passing the exam and having basic ABA skills. So what that means is we need to have systems knowledge. We need to understand special education law, and we need to have the ability to collaborate effectively among many different types of interdisciplinary teams. And when these supports are missing, plus some of the training gaps we've discussed, it can really translate into high risk. And those risks equal real risks of ethical dilemmas, poor outcomes, and significant burnout among us. And so this is one of my favorite questions to ask is how many of you have felt burnt out this school year? Every day. Oh, thanks for raising the hands. Yes, October was long. October feels like years. You're totally correct. Not yet. Oh, I love that for you, Becky. You do. Absolutely, Ashley. That's what we do. We just do our best. We do the best we can with the resources that we have available. My question is, what if we could better those resources? And what could that then look like if we are able to, right? And so we really feel that ethical preparedness is especially critical in schools because of these levels of high stakes, right? Like this is where ethical decisions happen every single day, whether to remove a student, how to respond to a directive, how to balance school, family needs, expectations, the use of exclusionary disciplines, high caseloads. And I'm sure we could keep going and probably going, right? But on top of that, part of the challenge is that the competing demands from, potentially administrators, teachers, families, and the students might all be different. And so aligning those expectations and aligning those demands can be really challenging. And we've known from other literature that it's likely graduate training doesn't often prepare us for these real world complexities, leaving us to enter schools pretty unprepared. And so with that in mind, my team and I, we really wanted to ask our fellow school-based behavior analysts, what are your thoughts? So we met, us 4 as an author team, and we were talking about the difficulties that we first had when we first started working in schools. We were all from different states. We had started working in all different times, but we all felt similarly. So we initially talked about doing a sort of literature review, right? We really wanted to dive into the current literature on ethics in schools. And so when we started that, we surprisingly, but not really, didn't find much. And so we talked even more and more and more again, and we decided that we wanted to dive into it. We wanted to get the data, we wanted to analyze it, and we wanted to see what to do next. So we ran a study. And the purpose of this study here was to summarize the perceptions of BCBAs regarding how well their graduate coursework and related training prepared them to work in school settings, particularly when they encountered ethical dilemmas. So some key things and variables that we examined were participants' perceptions of their graduate preparation and the types of ethical challenges they most often experienced in educational contexts. All this was to really support our overarching goal was to identify gaps in training and then to provide recommendations and tools to help better equip us for the realities of school-based practices, ultimately hoping to really enhance the ability to serve students of varying disabilities within these environments. So we designed a little online survey in Qualtrics to capture the perceptions of school-based behavior analysts. If you took it, thank you. Recruitment occurred through multiple channels. We had professional email networks, social media groups, word of mouth, a QR code shared at an online conference for ABA in schools, as well as a couple other local New England conferences as well. So some eligibility requirements that we had was you had to be certified. You could either be a BCBA, BCBAD, or a BCABA, and you need to have worked in schools. The survey did consist of different structured questions that included some screener questions that were mostly about certification, school-based work, and demographic information. And we also asked many questions on coursework, right? Whether participants in ABA graduate programs included school-specific content, how well they felt training had prepared them to address ethical challenges, things like that. We also included different rank order questions and open-ended questions about different ethical codes, core principles, and dilemmas that participants most encountered in school. So we got quite a bit of data with this really long survey. It was both quantitative and qualitative. And then the kind of fun of the data analysis began. And so this is what some of our participation data had looked like. We had 384 people initiate the survey, but after eligibility and screening questions were reviewed, we had 311 responses. So we had a lot of people, a lot of perceptions, a lot of things to be able to look through and go over, which was overwhelmingly exciting at the same time. Most participants were employed directly by the school district, about 3/4 of us, and 1/4 worked as an outside consultant. We are not sure what those 3 other people are. We wish that we had sort of put in like described situation, but we did have 3 participants that selected that option. And looking at different years of experience, the largest group had between 1 and 5 years, which aligns with the recent increase in behavior analysts in general per the BAE-SIG. However, we also had a lot of people and participants within 6 to 10 years of experience, and in smaller groups of 11 to 15 years, and a very small group of 20 plus. So this kind of gave us a mix of newer and seasoned practitioners. Geographically, the largest number of participants came from Massachusetts, California, and New Jersey. But we did have quite a few other responses from many other states and Canada as well. What did this look like? And I feel like some of this gets a little crazy, so don't mind me. Half of our participants reported that coursework had no specific content related to working in schools. More than half reported feeling underprepared to work in schools ethically. Only about 1 in 10 participants felt well prepared at all. I apologize. And so while we gathered a lot more data, and I'll go over some aspects of that, these are the most concerning. And the numbers to us here showed a significant gap between graduate coursework and the realities of school-based practices. What about for you here? I know I had already asked, did you guys feel prepared to work ethically in schools? But did any of your coursework include specific school-based content? No, and we're seeing that a lot. We even ran some different analyses too that I can talk about afterwards. Oh, yours did, Ashley? That's awesome. No, classroom management, sure. So what we had found was that a lot of this school-based coursework was more aligned with participants who had like their master's in education or was like a dual certification process. For people who had, like a straight ABA master's, we did not often see that there was coursework included in that content. Oh, good. Actually, I'm glad that your professors had asked for school-based examples. That would count for this piece. But it's concerning. This is the setting that the majority of our kids are in. School is mandatory. It's a law. There's a lot of us in this building. There are a lot of students that we need to serve. And so it's concerning that we don't have other examples and supports related in our coursework to support our school-based setting. We can do more than clinic. We can do more than homes. We can do more than hospitals, right? And so this is a very nuanced and difficult setting. And so it's a concern that half of our 311 people had no exposure to what that looks like. We also ran a thematic analysis, which was part of the survey. So there was one open-ended response question, and participants were asked to describe real-world ethical dilemmas that they had faced in school. And then we analyzed the theme. And the most common theme for this was related to responsibility to clients and stakeholders, which about 67 respondents reported dilemmas in this area, often being tied to like balancing student needs with district policies or administrative pressures, right? The second most frequent theme was responsibility in practice, which accounted for 51 of the responses. These often reflected questions like scope, role clarity, how to navigate those competing contingencies in schools. Definitely some aspects of professional integrity with issues like supervising trainees, but that did appear less often, still notable. But for this piece, the thematic coding supported that for some, the greatest strain for the school-based behavior analyst comes from managing competing stakeholder demands with the school-based system. Do you all often see that too? Yes. Oh, I love it when we get it, but how disheartening that this is it almost feels like a universal feeling, right? A universal perception of difficulty for this setting when it is such more and more every year. I know, it's heartbreaking, and we need to do something about it. Thematic analysis, we also generated a word cloud, which I thought was pretty, of the open-ended responses. And so this kind of visualization here that many of us may have seen from different types of conferences has shown the most frequently mentioned terms from that thematic analysis. So looking at it, we had higher, things that would stand up to us, like caseload, support, code, teachers, understand, and practice are all the words that sort of stood out to us. And the prominence of these words kind of visually reinforced what we saw in the coding, is that ethical dilemmas most often emerged when balancing student needs with the expectations of multiple stakeholders within the school system. So here was where we started to see some more of that pattern. This is a difficulty. This is an area of concern. This is a problem. We also ran a correlation analysis to look at how certification level, coursework, practicum, fieldwork, and collaboration all related to perceptions of preparedness or not. So a positive correlation means that as one variable increases, the other also tend to increases, versus a negative correlation means as one goes up, the other goes down, and vice versa. So one of the most interesting findings was there was a strong negative correlation between practicum and ethical preparedness, suggesting that potentially more practicum experience didn't necessarily translate to feeling more prepared ethically in school settings. Now, something that we had to keep in mind for this piece was that it's absolutely possible that some of these practicum sites were clinical and not necessarily school-based. So it would make sense that they wouldn't feel prepared even with their practicum hours because it might have been in a different setting. Supervised fieldwork, also independent fieldwork, also correlated negatively with ethical preparedness, and coursework was similarly negatively related to ethics. On the more positive side, collaboration preparedness positively correlated with ethical preparedness, which is exciting. And coursework preparedness also had positive associations with ethics and collaboration. So kind of taken all together, these results could suggest that collaboration may be a key factor in ethical readiness, and that coursework and practicum might need to be better tailored to school-based realities. However, this is just a correlation, so more research and dives in this area is absolutely needed. We had some rank order questions too. So for this one, participants were asked what graduate coursework should emphasize most. And scope of competence was the clear number one answer, with 1/3 of our participants ranking it as the most important piece. Special education, law, and ethics were also ranked high, collaboration more towards the middle, in matters of employment and or other were consistently ranked the lowest. Participants also ranked which sections of the ethics code they most frequently encountered dilemmas in. And so by far, the most common was responsibility to clients and stakeholders, with 44% ranking it first. Responsibility in practice and responsibility as professional closely followed. Supervision issues were less frequent, and dilemmas related to public statements or research were often the least reported, which does make sense for this setting. What are your thoughts on this one? I always like polling my new audiences. Do you agree, disagree? What would you put now, knowing what you know, or your experience the past year or so working in public school? What do you guys would think, let's start with the first one, would be most important out of these pieces? What do you think that graduate coursework programs should focus on moving forward? Yeah, I agree, Scott. That makes sense. Special ed law, yes. Definitely. I had to teach myself on special ed law, which I'm sure most other people did. You are. Collaboration is so huge in this setting. Absolutely. For sure. What about the ethics code? And again, this one would be like ethical dilemmas that you've encountered often. So if you don't want to respond, I completely understand. But you can agree or disagree. Where do you find, according to these areas, that you might have the most ethical difficulty working in schools? A conflict to me. I get it. And it's a lot, and it's really hard. The setting is so complex. The last one that we had rank order was participants ranked the core principles of our ethics code where they most often face dilemmas. Ensuring their own competence was most frequently reported as a top challenge. Benefit others was often seen as the most second common, and while treating others with compassion, dignity, and respect and behaving with integrity tended to appear in the third and fourth position, respectively. And so, again, looking at all these rank order questions, continuing to reinforce some of the things we saw in the thematic analysis and the correlations, right? That competence, law, ethical responsibility, and collaboration are really at the center of the ethical dilemmas that we face and could better use some support in. So to sum up some of the data collected somewhat reinforced what many of us already felt in practice. Our training left us underprepared for that school-based setting. The ethical dilemmas that we face are complex and frequent, often involving competing demands. Collaboration and systems knowledge emerged as essential, but they are not consistently emphasized in our trainings. And so our kind of bottom line here was that we need more targeted supports. We need these supports in coursework and supervision and peer networking in our research and our literature to better prepare and sustain and support our school-based behavior analysts. So putting it all together, what could this actually tell us really? And so firstly, when we looked at all of this data after a long time, we really kind of took a sigh of relief. One was that we were done analyzing all of that data, but also we felt really validated. The data was matching how we had felt while working in schools, which is great. Yay, it's hard. We knew this. We knew that we weren't prepared. We know that there were many challenges in the setting that we all face. And so really lots of conversations were had among our team. We're like, great, we know this now, but now what? And we ended on an overwhelming need for school-level specific ethical guidance, both at an individual level and an organization level. So at the individual level, BCBAs working in schools need preparation and support that goes beyond exam content, training that equips them to navigate complex school systems, balance stakeholder needs, and make ethical decisions in real-world contexts. But also at the organizational level, administrators and school system stakeholders also have a role here. They need to recognize the unique challenges that we face, help support systems and structures like supervision, peer support, professional development that can reduce isolation and support ethical practices. So really, this isn't just about us. It's about the system and how it can all be better aligned to help support students, educators, and our ethical practices. So what came out of this work really wasn't just data. It was the development of a tool. So we designed this tool to directly assess the gaps identified in our survey, but it was also built specifically for us school-based BCBs. So it's short, it's readable, but it can also strengthen our practices, collaboration skills, systems knowledge, and can be shared and supported. It's flexible. It supports us at both of those levels, at the individual level, but it could also be used as a guide for administrators, school systems, in structuring these supports and having a better understanding of the role that we do. And we really wanted to bridge the gap between the BACB ethics code and the realities of working in schools. We wanted to provide guidance that was not just conceptual, but really practical and something that a BCBA could use when faced with a difficult situation. And importantly, again, it's designed for those two audiences, us and the system. Because with ethical practice, it's not just the responsibility of the BCBA, it requires that systems level support that we are then working and evolving. So to make the tool easy to use, we organized it towards the BACB's areas of ethical responsibility. And that first section is responsibility as a professional. That covers our conduct, our competence, and how we represent ourselves within the field. The next one is responsibility in practice, including how we design, implement, and evaluate behavior analytics services in ways that are both evidence-based and ethical. Third is responsibility to clients and stakeholders. And in schools, that doesn't just mean the students. That means families, teachers, administrators, peers, or systems level work where our client or stakeholder is the district or building themselves. And so each of these groups has unique needs and expectations, which can create more ethical complexity. And finally, we have our responsibility to supervisees and trainees. And so there are many school-based BCBAs that also supervise RBTs. Maybe not. Maybe paraprofessionals, graduate students, or maybe have other evaluatory responsibilities, right? And so supporting their competence while balancing school demands can also be challenging. And our survey found that BCBAs working in schools have experienced ethical challenges in each of these areas. So the first domain I kind of wanted to go through and show you, and this is kind of what jumped the tool just to fit on the slides, but we'll look at is this is the responsibility as a professional. So these challenges included scope of competence, like being asked by an administrator to take on tasks outside of our role, or navigating laws like IDEA and IEP requirements, or managing multiple relationships. We also encounter situations where we might need to manage administrative expectations. So administrator might ask us to approve or implement an intervention that doesn't exactly align with our science or professional code, which puts us in a very difficult position. Does anybody have any experiences with that? Being asked to do something many times. I see it. It's a common one. That's why I tend to bring it up, because I always liked asking the different audiences of that, because that also seems to be a pretty universal experience. And it makes sense, right? If they don't understand what we do or why we do it, they don't have the same training that we do, and that's okay. But it can just make things difficult. Another issue is navigating the laws and professional requirements of schools. Things like IEP compliance, IDEA regulations, the least restrictive environment. So these legal frameworks overlap with our ethical code, but they don't exactly align perfectly, which can create some more complexity. And finally, there's some concerns about dual relationships, because schools are such close-knit communities. It's easy for blurred lines to emerge with colleagues, families, or even students or peers. Adding on different aspects of, maybe you're a parent and your children go to the same school district that you work in. That happens to me, right? My two kids go to the same school district that I am working in, and what difficulties can emerge from that can be hard. So on the individual behavior analyst side, some key guidance could include pursuing professional development in special education law and collaboration, being clear about your role and your scope of competence, using supervision or mentorship to navigate those gray areas. And if you don't have those, working with your district leadership to advocate for that, right? We also, really encourage the use of structured ethical decision-making tools, such as those from Bailey and Birch or Broadhead, right? And I also have those, so if anybody would like them, you can send me an email. I can send you what we... At a systems level, schools also have responsibilities. So that can look like school-specific onboarding for BCBAs, consulting with other districts before creating positions, supporting continuing education and school-relevant topics, and then importantly, avoiding the assignment of duties outside of our scope. Administrators can also then use this to make an effort to learn what behavior analysts do and how that connects to the broader school system. So here you can kind of start to see a little bit of how the tool works. Pairs common challenges with practical guidance for both individual behavior analysts and school systems. So taken together, the steps help to build and strengthen our ability to act responsibly as professionals in schools. They also can help build systems that make it easier to uphold our ethical practices. No problem, Cynthia. Feel free to send me an email and I can share with you some of the literature and research on that because I definitely use them frequently. So then there's this one. Oh, wait, did I already do this one? This is responsibility as a professional. Ooh, where am I? Oh my gosh, did I go over them? I totally lost track of where I was. Okay, responsibility as a professional. We did this one.
Yes, you did do that one.
Do that one. What am I today?
I think you're the second one then. So you did the responsibility. There.
They all look too similar. I need to label them at the bottom. Okay. So this one is the responsibility in practice, right? So it's the day-to-day work of what we do all the time. So challenges in this area could include consent. Oops, so sorry. Julian, do you have a question? Sorry. Oh, no, you're good. No problem. This one could include like consent, treatment integrity, confidentiality, data collection, navigating limited resources, medical concerns, right? So we also face pressure when it comes to providing effective treatment, right? So schools may encourage practices that are convenient or cost-effective, but not necessarily aligned with evidence-based best practices or to what the data is pointing to we need. So as behavior analysts, our ethical responsibility is to prioritize effective, research-based interventions. And finally, a big one is to identify barriers to service delivery, right? Limited staff, limited resources, limited time, limited materials. So even we know the right thing to do, we may be constrained by our resources, which can create some ethical tension, right? So all of these challenges may highlight why responsibility in practice is so complex in our school-based setting. So for individual analysts, this means embedding consents and integrity checks into plans, using HIPAA and FERPA compliance systems, being clear about our needed resources, supporting, collaborating for potential medical or biological needs that could be contributing, and educating others about our ethical codes. And for the system, this means, what we would love to see one day, right, is a caseload limit, providing tools and staff support, protecting training time, fostering open dialogue, since school policies don't often align with this code, right? So people only know what they know. And that's fair. And so it's not reasonable to expect non-BCBAs to know and to adhere to our codes. So that's our responsibility to educate and support those conversations and collaborations. All right, so just an effort to save a little bit of time, I'm going to briefly go over these last two domains that focus on responsibilities to clients, stakeholders, and supervisees. They are set up in the same format that I had shown you. So for clients and stakeholders, the tool addresses challenges that often involve conflicts with administrative directives, pressures to act outside of our best practices, confidentiality limitations, and the ongoing need to ensure that we are advocating for the person who is the recipient of the service. And for our supervisees and trainees, challenges could include like inadequate time for training, high staff turnover, the need for consistent evidence-based methods for training, like behavior skills training. And across both of these domains, the solutions can overlap. And what can help with that is like setting clear role definitions, advocacy for manageable caseloads and resources, embedding in those evidence-based training supports, and fostering collaboration and compassion across all of those different systems. So how the heck do we actually use this tool in practice to begin with, right? So it serves as a decision-making guide when navigating ethical dilemmas by grounding our responses in both our BACB code and school-based realities. It helps us to choose a path that is more ethical, defensible, and practical. It can be used as a training resource for new hires. Schools can provide it during onboarding so that new BCBAs or other professionals can have clear expectations and shared language of the expectation of our ethical practices. The tool can provide an advocacy framework for systems level supports, and it can give us a way to communicate with our administrators about what structures, like our caseload or time for those caseloads or time for trainings are needed so that we can uphold our ethical practices. It can also support determining caseloads in a way that is transparent and based on our ethical obligations, not just demands. So this tool, paired with calendars, timesheet logs, services, intensities, needs, and meetings, could help advocate and support for what is needed for you and your students' levels of successes. It could also be related to help support different systems levels of support that you're working with. Maybe you're less of a individual student caseload and more of a systems level caseload. But what does that look like in practice? And how does your time and your feasibility to carry out that caseload work for you? So related to that, it can help support some onboarding practices and learning of new district and district level systems and policies as well. And lastly, it can strengthen IEP advocacy alignment, helping us ensure that what we recommend and advocate for in IEP meetings is consistent with both our ethical code and our best interests of the students. So kind of in short, this tool is meant to be a practical guide. It's not really just a theoretical framework. It's something that BCBAs in schools can put into action to support ethical, effective services every day with a shared understanding and agreements with everyone involved. So I can walk through some case examples, right? So here we have Jordan. I'll pause and give you guys a second to read. And then I'll go through. So Jordan here, middle school BCBA. The principal directs Jordan to reduce paraprofessional support for a student, even though the FBA data clearly showed that this support is necessary for student safety and engagement. Jordan recognizes right away that this request puts her in a potential ethical dilemma. So on one hand, she's being asked to follow an administrative directive. On another hand, she has a clear obligation under our code to provide effective treatment and advocate for appropriate solutions and services. So this is the type of situation that this tool could be designed to help with. Jordan could use the tool to guide her decision-making, framing the issue in terms of ethical responsibilities, documenting the data, and advocating from a position that is both professional, ethical, and defensible. Coming up with solutions that support the district and, importantly, the student to be the most successful they can be in the least restrictive environment. It also highlights why collaboration with administrators is so important. Oftentimes, they may not just be a level of understanding with our ethical code that governs our practices, right? So using a structured tool can help shift that conversation from it feeling like a personal disagreement to being about professional standards, students' rights, and what's in their best interest. So here's how the tool could potentially guide Jordan through this situation, right? So step one, you ID the dilemma. So in this case, the conflict between an administrative directive and her ethical obligation. 2, clarify the scope. Her role is to support students through evidence-based practices. 3, reference that code. For example, 2.04 on effective treatment and 2.09 on advocacy. Step 4, you might want to consider generating possible options, agreements or disagreements. Lay them all out on the table. It's important to be solution-focused, all having the best interest and shared goal of supporting that student in mind. Then you might select a plan. Advocate for continued use of support using that FBA data, or identify alternative support options. Under what conditions do they need that certain support? What are the training needs? What are the support needs for teachers or other people implementing this plan? Selecting the people responsible for implementation and monitoring. What's the FADE plan? What data sources are we using to monitor levels of successes? It's important to be clear, open, honest, and realistic. And then document your decision. Consult a supervisor as needed, follow up district leadership as needed. But this is just one example of how you can navigate and use that tool to help resolve a situation. One of the most powerful ways to use this tool is not just to resolve an ethical dilemma, but to prevent them from happening in the first place. So that could start with conversations including caseload or resource requirements and contracts. If the expectations are clear and upfront, it could potentially reduce the likelihood of being asked to take on something that's unmanageable. Another strategy is to present administrators with an overview of BCBA roles and limits at the start of the school year. So many of the conflicts we encounter stem from others not fully understanding what we do or what our scope is. So setting that stage early can create shared expectations of support. We can also establish written agreements that treatment recommendations will be guided by data, not preferences, and having that documented kind of makes it easier to hold firm when and if pressures arise. And finally, regularly reviewing our ethical decision-making and supervision or support with anybody really could help us strengthen our advocacy skills. So when we practice navigating through tough situations with colleagues or supervisors or peers, we're more prepared to then respond effectively in real time. So a big takeaway here is that there's kind of proactive steps clear agreements, education, and preparation to help reduce the number of ethical conflicts we face to make it easier to uphold our professional responsibilities. So I'll give you guys a second to read this one too. But we're going to highlight a different challenge, more dual relationships. Nothing. I should preface that these were all made up examples, but still. So Sam's a BCBA who works in the same school their child attends. A teacher, who's also a close family friend, asks for an informal consultation outside of Sam's contracted role. At first, it might seem really harmless, but Sam realizes it's blurring professional and personal boundaries that could compromise objectivity. So this example kind of reminds us that not all dilemmas are about data or resources, and some are about relationships, expectations, and boundaries. And so the tool could be used here as well by clarifying the scope, reinforcing ethical codes, and generating options for how to navigate that situation. So applying it to Sam's situation, we're going to identify the dilemma. Here, the conflict comes from an overlapping role, both from being a friend and a professional in the same school setting, which can create risk of conflict of interest. Clarifying scope. Sam's role is to maintain objectivity and prioritize student needs. Taking on informal consultation outside of contract obligations can blur those boundaries. Referencing our ethical code, the one that we felt that was most relevant here was 1.06, which requires us to avoid multiple relationships that could impair that objectivity. And then we can also look into Section 2, which addresses our responsibility to clients. Generating some options. Sim can technically do a million things here. Do it, not do it, ignore it, refer out, etc., etc. Again, laying them all out on the table is an important conversation. Select a plan. The most appropriate action might be to respectfully decline informal consultation while suggesting the teacher, go through other proper school-based channels. In this way, Sam avoids a dual relationship while still offering a path forward to support their friend. And step 6, document. That documentation not only protects Sam, but creates a record for ethical decision-making and support. So for this example, it highlights how the tool can take what seems like a personal or awkward situation and turn it into a more clear professional response anchored in our ethical code that takes out that personal biases and supports. So as we kind of bring this all together, some of the key takeaways is that this tool is designed to support ethical integrity for BCBAs working in schools. By grounding our work in the BACB ethics code while addressing the unique realities of our school-based systems, we can better navigate and prevent ethical dilemmas. And also promote social validity and dignity, ensuring that our practices are not only technically correct, but meaningful, respectful, sustainable for our families, our students, and the educators that we're working with and supporting. Importantly, it provides a framework for sustainable practice. Rather than leaving individual BCBAs to figure out solutions on their own, this tool can help create systems and processes that help make ethical practice more consistent and more achievable. And so looking ahead, some of the next steps that we have for this are dissemination, refinement, training, and so many more data analysis. Dissemination meaning for us, like sharing this tool widely so school-based BCBAs and administrators can start using it. Refinement from that will come from feedback and more real-world application for sure. But also a training component would be crucial and critical for that to ensure that both BCBAs and school leaders know how to use it effectively. So ultimately, this is about building school systems that allow us to uphold our ethics while delivering the highest quality services we can to our students. And that's a goal we can only really achieve through collaboration between behavior analysts and the schools that we work in. So this is just kind of the start of what my team and I would like to do regarding this. And we hope you agree that we really want these ethical practices to truly take hold in schools. We need to shape the systems around us, not just to react by them. We want to bring this tool into our daily practice, to our school communities, so we can move beyond surviving ethical dilemmas and building environments that are ethical and effective to support the students that we're working with. How am I doing on time? Do I have time for thoughts and questions? How are we doing?
We have 7 minutes for thoughts and questions.
Wonderful. Excellent. So what do you guys think? This also has been submitted for publication, just so everyone is aware. So hopefully we'll be able to have some more dissemination that way in the published literature.
Fina, I know that the chat has lots of examples of people really wanting the tool to be able to use it.
I know. Yes. And I would love to be able to share, but because we're just waiting on where publication has been, where BAP, Behavior Analysis and Practice, Tracy, we have received our response yet. So we have. So once we have our we've received our initial response. Once we have our final response, I'll be able to share it more freely because there might be some edits. And I want to give you guys an edit of a tool that might need some more work on it. Casey, I wonder if I could email it to the SIG once it's published or when it gets published to be able to share and disseminate for sure.
We can absolutely send it out to our everyone who's registered as a member, which is about 300 people in California.
Oh my goodness, that would be so cool. And I had a slide that had my email address up. I am so sorry, but I didn't even show you. So I'll just put that in the chat too. But I'd be happy to hear from you guys if you have any additional questions. I think that, yeah, I agree with you that it's been difficulty creating systems and supporting systems, and everyone is feeling like we're on an island. And I truly, truly, truly believe that our school systems are doing the best they can with the resources that they have available. I don't think anything is malicious. I think that everybody is doing their very best in working with what we have, but no one knows what we do and what we know better than us. And so providing those resources and supports, I think, are paramount in supporting everybody else's, acknowledgement and supports with those pieces. Oh, thank you, Richard. Any other questions or thoughts, either regarding the data or the tool themselves? I agree that doing district training can go a long way, for sure. And that we can be, effectively utilized in those pieces. We're great trainers. We could utilize a teacher interaction procedure. We can utilize behavior skills training. We can utilize those levels of reinforcement and support to effectively engage and work on all these different things. Thank you, Tracy. I know caseload guidelines is that was one of the projects that we were considering tackling too, Lauren. I can't agree more. It's just really difficult because not every caseload is the same. Not every district uses us the same. And so those guidelines can be really tricky. But I agree. I do, Sean. I do think that would be helpful for this. It's just a guide, right? So it's just one data source to have and support these pieces. So this guide, combined with all of your other data sources, combined with your clinical judgment, combined with our ethical code, combined with district recommendations, really could help support that. I don't. I can check my thing, Cynthia, but off the top of my head, I'm not sure I have one for recommending a feed of those pieces. I know everyone in education feels so burnt out right now. You're absolutely right. I know it's like almost adding in another layer of complexity where people are so dedicated to this field and so dedicated to the work that we are doing that adding on something else can be incredibly overwhelming. Yes. Yes, we've seen that too, for sure. Especially, definitely in my school district. It's hard. Oh, I don't know about that one. But I really appreciate everyone's time, your attendance, your questions, your participation. I love this stuff. I want to be able to do more, and I want to be able to support as much as I can any fellow-based, school-based behavior analyst. So if anybody has any questions or need anything, I'd be happy to meet, to discuss, to provide resources, and to support anyone.
Thank you, everyone, for being here. If you have any questions, you can stick around for a couple more minutes.